Diabetes mellitus is very common in our community. It's not only in our community, but it's a nationwide. Rather, I would say it's increasing worldwide. We see almost it's becoming a pandemic. 6.7 million people have died of diabetes. The total worldwide at present is about 540 million people have diabetes mellitus. It's one of the seventh leading cause of deaths in the world because of the diabetes. Every 1 in 10 person is adult person is having diabetes currently. So we look into the reason why this diabetes has been increasing. It's surging so rapidly in the world. When we analyze and look into the cause and the reason for diabetes, we find that it's the lifestyle, the modern lifestyle which we have adopted, that is causing diabetes. What do you mean by the lifestyle? It's lack of exercise and the diet or food habits. We have been overeating. We are after the fast food, refined sugars, the food of convenience on the shelves. We are eating, popping up food, frequent, not only the regular times. So this is one of the main factors, the root cause of the increasing causes of diabetes mellitus. The second thing is in our inactivity. We lack of exercise. We have adopted sedentary life. Once you gain the weight, again the chances of diabetes increases. The other factor is lack of insight about the diabetes. So how do the patient present those who start having diabetes, new onset diabetes? Basically, there are three things. 3P we say: polyuria, polydipsia, and polyphagia. What do you mean by polyuria? Polyuria means the frequent urination. Second sign is polydipsia. He would be drinking water more, feeling more thirst. The tongue is dry, keeps on taking sips of water. That points again toward the diabetes mellitus. The third thing is polyphagia. What is polyphagia? Polyphagia means you feel hungry, so they tend to eat more and they gain weight. Or the patient may be losing weight rapidly. Tell you in few months I lost about 5 kg. So that should point toward diabetes again, you should think. These are the main symptoms of diabetes, but some they can come with the infection. You go to the dentist has got an abscess, he wants to remove the teeth, he'll give antibiotic, but it's not working. And when the dentist refer to us, we check for sugar, we see very high blood sugar. That may be presentation. Basically, there are 2 types or 3 types of diabetes. There's type 1 diabetes, or it is called insulin-dependent diabetes, or familiar diabetes, another people they call it. And the other type is type 2 diabetes, or non-insulin dependent diabetes, or adult onset diabetes. It starts in the later part of the age. And there's a third one, not very common, it is called gestational diabetes. So type 1 diabetes, it's an autoimmune disease. It may run in the family. It starts early in the childhood. What happens is your own cells, they destroy the cells which produce insulin in the pancreas. So these patients, they are thin, it runs in the family, and we have to give them inject with insulin. They have to take insulin lifelong. The other type, the most common, which now is becoming pandemic, is type 2, or the adult onset diabetes, and it is affecting about 9 million. 90% of the diabetes is type 2 diabetes. This is the one which is present. We see a lot of cases, a lot of surge in it. In this, insulin is there in the body. There's insulin, but there's insulin resistance. I mean, the insulin, it cannot push the sugar into the cell. It bounces back and it floods with insulin in the blood. So what we do is we give the medicine, the tablet, to sensitize the cell wall of the cell wall, so that the insulin can push the sugar into the cell, and the cell then, it metabolizes and it produces the energy which we need for our body. The third type is what we call gestational diabetes. This is in the women who are pregnant. It accounts for about 17% of the diabetes. You have to start walking, playing sports, cycling, swimming. All this will help to burn your energy. We come to the diet. That is the most important. Diet. Diet is the cause of main problem. I said we are overeating, we are popping off food. It is increasing our weight. So I'm going to talk in detail to you about the food which we consumption now. So what we can't eat. So everything underground we can't eat. Being eat potatoes or anything made of potato, whether fries or anything, cassavas, yams, sweet yams, carrots, beetroot, all these things you can't eat. Coming above the ground, rice. No rice every day. If your sugar is controlled, then you can make it twice a week. White flour, that means anything made of white flour. Pancakes, mandazi or paratha, puris, anything made of white flour, you can't have. Ugali, you can't have. You can have dona, okay? So what you to eat? You can take atta. Chapatis made of wheat flour. Attas you can have as much as you want till it fills your stomach. What else? You can have all the pulses, lentils, dal, the other very good food for the diabetic is vegetables. All vegetables, leafy vegetables, all kind of vegetables. Vegetables are good. You can have fish, you can have eggs, you can have meat, chicken. All these are allowed for the diabetics. They're healthy. Honey is not good for diabetics. Dates is not good. A lot of my patients, they are healthy, they have a lot of health benefits, but yes, that's very true, but not for diabetic patients. If you are not diabetic, then okay, dates, honey, all are good, So among the food, see, there are a lot of food you can eat. All the vegetables you can have, Carrots I've cut because underground, it's a tuber. But all leafy vegetables, cabbage, aubergine, beans, cauliflowers, all kinds of vegetables can be eaten. Fish, chicken, mutton, beef, eggs, milk, all you can have. All the lentils you can have. Chapatis made of wheat you can have. Bananas, the raw bananas, or they cook, some people, it can be eaten. Brown bread, not white bread. And pastas or this, which are made of wheat, all you can have, No sugar in the tea. So you can add those sweeteners. No sodas. If you want to have, you can either have a fresh juice, squeeze at home, orange juice, passion juice, but no sugar to be added. The best I advise my patient is to have coconut water, madafu, we have here, is the best electrolytes and so many advantages. Coming to the fruits, all fruits have sugar, but these are fructose sugar. They are better than refined sugars, fine sugars, But there are certain fruits we have got a high sugar and some with low sugar. So low sugar can be consumed in moderation. High sugar is to be avoided because they spike, immediately they flood, the blood with sugar, So among these are mangoes, which is season now, Mangoes, ripe bananas. But I said you can have the raw bananas, cooked one, but no ripe bananas, no grapes, no pineapple, no watermelon. Watermelon has the highest glycemic index. If you can see on the chart over here, it is the highest, greater than 70. I would say. Immediately the sugar rises up in your body. Watermelon. No papaya. This is, most of my patients, they do consume papaya, Papaya, all these pulpy fruits, they have a lot of sugar, high sugar content, the spike, But the citrus fruits, they are better one. Apple, not red apple, but green apple you can have. Oranges we can have. Tangerines we can have. Chenza. Kiwi is one of the best to have fruits. It's very good. Grapefruit. This is also, it helps in the diabetes. Avocados we can have. It is very good. There's a lot of benefits for avocados. And all the berries, strawberries, blackberries, cranberries, this jamun, zambarao, they are very good for diabetes. What are the complications of uncontrolled diabetes? This is causing disaster. A lot of people, they suffer diabetes. Their quality of life gets impaired because okay, they may be having sugar, they're alive, but they are in kidney failure, or They are bedridden because of stroke, because of this complication of the diabetes. We see the lot of cases, increased cases of the heart attack, heart failure, this cardiovascular complication, because it's up to 4 times more common in diabetic than non-diabetics. They get heart attacks and everything. The other is stroke. Stroke is twice common in the patients with diabetics, And these are if you're only diabetic. If you've got other risk factors like high cholesterol or high pressure, if you are smoking, the risk of these heart attacks or stroke, it even increases if you are a diabetic patient. The microvascular complication is in the eyes. In the eyes, you may get early cataract, or you may lose your eyesight and become blind. 1 in 3 of the diabetics, they lose their vision. The other one is kidney, what we call diabetic nephropathy or chronic kidney disease. About 10 times of the patients with diabetic, they go into renal failure. Most of the patients who are on dialysis currently in this country is because of uncontrolled diabetes, And it's a silent killer because you don't know. By the time you come to know, your kidneys are damaged because you don't feel anything, you don't feel pain or anything when your kidney starts failing. You go sometimes to the dialysis center, they don't have electricity, depends upon generator, they've got a lot of side effects. There's dialysis, those tubes can cause infection, you can contract AIDS, you can contract HIV, you can have hepatitis or other infection. You'll find the people, they don't survive for very long. Those fistulas they get infected, they get blocked. And so I don't, you should control, I don't recommend this dialysis. You should not wait to go to that end stage of kidney disease, The other one is to go abroad for a renal transplant, get a new kidney. That's also not a simple thing that you pay, you get the kidney. You have to wait, you have to type. Even if you get the kidney is of somebody else, it may be rejected. So you need to be on about 10, 12 drugs to prevent the rejection of the drugs, your immunosuppressant drugs. So you have to be careful for your kidneys. It's very common, 10 times more common, diabetic nephropathy. The other thing which is commonly we see in most of diabetic patients is diabetic neuropathy. The nerves get damaged, 6 out of 10 of the patient diabetic, their nerves will be damaged, especially the nerves of the feet. They feel numbness, they feel burning sensation at night, or they may not feel pain. They can't feel the pain. And so the takeaway message is we should be active, we should be walking, playing, sports, everything. Take care of our diet. We should have regular meals. We should have food with low glycemic index. Unnecessary, we should not pop food in our whenever we are in front of the TV, in the car, when you go out for anything, outings, we always carry the food, and we should be careful. Have a sensible approach to our food intake. Medicine, we should adhere properly medicines. Take medicine as prescribed by the doctors. If you are overweight, you should try to lose weight. Between 5 to 10%, you should try to lose your weight. It will help a lot to control your pressure, your sugar, your everything. Reduce salt in your diet. If you're smoking, try to reduce or abstain from smoking. Important is also to have adequate sleep. 7 to 8 hours of night sleep is very important. Regular follow-up with your doctors. To consult a dietitian, who can help you. We have in our hospital nowadays dietitian advise you about which food you can take to lose your weight, of control of diabetes. Family support is very important also. So the members of the family, patient is diabetic, and if they eat everything on the table and the other person doesn't eat, so there should be a family support, for the healthy diet, Last but not least, for the caregivers, it's very important to know the symptoms of hypoglycemia. What we mean by hypoglycemia is when the sugar goes low due to medication, over-medication. High sugar will not kill you instantly. You will develop this all complication, kidney, this thing, but it will not kill you instantly. Low sugar, it can kill you instantly in 5 minutes. So it's important the family member who take care of the diabetes, they should know what are the symptoms of hypoglycemia when the sugar goes very low.